who are allowed to get out early are those who either have means or have had very few or infrequent brushes with the law, leaving behind those that often have serious mental illness issues as well as long and persistent substance or polysubstance abuse. So unfortunately, we have a situation where although the population has declined, those remain to be our sickest and most needy patients. So as a result, despite the reduction in population, there has not been a concomitant reduction in the amount of services that we have to provide. In addition, correctional health care, as was recognized at the last commissioners meeting, is really a nuance. And we are in somewhat of an unusual situation where of late society demands require that there are more services made available for those that are incarcerated than can be made available in the community. A perfect example of that is medicated assisted treatment, which is now being compelled upon all individuals who are in a correctional facility, whereas in the community, those individuals who are suffering from that unfortunate disease, absent insurance or some other means for payment, do not have readily available treatment. But in the facility, we do. So we've been asked and have been providing those services as well. As well as the reduction in community mental health services, it is again readily recognized throughout at least this Commonwealth that your county correctional facilities have turned into your mental health treaters. It's an unfortunate situation. It's statistically true that those who suffer from mental health illness remain incarcerated longer than those that do not. Usually it's not as a result of any severity of the charges that they have, but instead as a result of the inability to find community placement for them. Moving to my second point I would just like to make. For everyone's benefit, we provide 932 hours of man-hour services a week in the Lebanon County Correctional Facility. That runs the gambit from physicians to psychiatrists to 2 mental health counselors to dentists to mid-level providers as well as nurses, both RNs, LPNs, as well as medical assistants. That equates to over 48,450 hours a year of services. As Commissioner Litz noticed in the prison budget last commissioners meeting, about 90% goes into prison in terms of their staff wages. The same is applicable to us. We all know what has occurred with wages in the last several years, as well as the shortages in the healthcare profession. So as a result, the most significant portion of that budget for us is composed of those 48,454 hours that we have to provide on a yearly basis. What do we do during those hours? For last year, we completed over 1,400 intakes. So when anyone is incarcerated, within the first 4 hours, we perform an intake on them. That intake, ours, is the foundation of our treatment plan for that individual, whether they be with us for a weekend or whether they be with us for 2 years. It also begins the discharge planning. What treatments are these individuals going to need once they're released? That process takes 30 to 45 minutes per individual. In addition, last year we had 334 individuals that we had to go through detox for some form of substance abuse. Those individuals will require 3 visits a day just to make sure that they're doing okay. It's our philosophy to treat withdrawal prior to any symptoms occurring. So the moment they come in and flag is likely to detox from some substance, they're going to be automatically prescribed medications as well as followed on that regular basis for a period of 7, 10, 14 days to make sure that they've come through with that, through that withdrawal. Last year, I'm very proud of 2023, where we started our medicated assisted treatment here in the Lebanon County facility. And last year, we treated 239 individuals in an MAT program, both on methadone and some form of buprenorphine. And that was starting from 0. And we are now consistently running in excess of 23 to 25 to 30 patients a month. So I imagine that number will be double at the end of 2024. One of the most proud statistics I am, in the whole year that we had in 2023, we had 11 grievances filed against the medical department at the prison. 2 of those were founded. I think when we have several 100,000 patient encounters a year, that level of grievance complaint alone is remarkable. And then to only have 2 of them founded shows what a fantastic job is being done over there by our staff. 63% of your population for the year was on medical medications. we did 965 14-day physicals. After we do that initial intake within the 14 days, or excuse me, within the 4 hours, within 14 days, every individual goes through a medical assessment by a doctor or a medical provider, and that's how it occurs in Lebanon. In other facilities, we may have a nurse who's been trained by one of those to do a more thorough assessment. We performed 2,254 COVID tests last year. We had 1,603 visits by the psychiatrist in the facility, and we had over 3,400 visits with a mental health professional. In our facility, if you ask for mental health treatment, you'll be seen within 72 hours. I would beg anyone in the community to decide that they need to see someone for mental health and see if they can be seen within 3 days. We had 796 individuals in our mental health chronic care clinic. We have a number of chronic care clinics for anyone who flags with a chronic disease, whether it be hepatitis, diabetes, hypertension, or mental health illness. Those individuals will be followed on a regular basis and seen no less frequently than every 90 days. We had approximately 800 individuals classified in that manner in our mental health area. 51% of your population is on psychotropic medications. We had 142 patients last year on a suicide watch to preserve their safety. We also had 510 dental visits last year. Those are just some of the numbers to give you a breadth of the frequency of patient contacts. We, in addition, do 3 med-pass-a-days where they're going around and handing out the 63% of medical medications, 51% psychotropic medications. Those can take hours on end. The MAT administration program is extremely labor-intensive because we want to make sure that we can control diversion. Up until the last 2 or 3 years, the concept of doing MAT treatment in a prison was prohibitive because of the concern. These medications are treated as contraband. They posed a risk to the patient taking them. So everyone has a concern. So it is a lengthy, time-consuming process. The last point I want to touch on are some of the hidden savings that going with an entity like PrimeCare can produce for a county. When we began the contract in June of 2019, up until we had the opportunity to have our contracted pharmacy come in place, the county was expending approximately $60,000 a month on pharmaceuticals. It's been averaging $20,000 a month since we came in. That's a savings of $480,000 a year, or over the 4.5-year period, a savings of $2,160,000. Another service that we provide that does not show up in our contract or in the bottom line of our contract is for all outside service your patients require. The medical unit, and I encourage anyone to visit it if they have the opportunity, we don't have an infirmary. It is not a hospital setting, it's not an ER setting, it's more aligned with your family practitioner. There are certainly treatments that cannot be provided within the facility, such as OB/GYN, complex orthopedics, any kind of post-surgery treatment obviously has to go out for appointments. For any outpatient treatment, since we've been here, the county was billed $3,396,977.93. One of the services that we do is we, as your own health insurer would do, when they get the bill from Hershey Med or Good Sam, your health insurer goes through there and says, okay, the bill might have been $200,000, but we're allowing whatever the allowable amount is. We do that same scrubbing for Lebanon County patients. Of that, over $3 million, almost $400,000 that was billed, in the same period since June of 2019, we paid $577,000, a savings of 83%. For any inpatient treatment, the county was billed $1,514,790. We paid $118,759, a savings of 92.2%. If you take those 3 factors of services that don't appear necessarily in the budget bottom line, since June of 2019, we're proud to say that we saved the county over $6,300,000. So again, I'm not here to dissuade you from putting the matter out for RFP. In fact, there are reasons that it would be beneficial for us to do so. But I do want to make sure if you go through that process, you recognize the nature of the services that are required to keep your patients safe, as well as recognizing that perhaps staying local isn't the best thing in terms of some service provider. That former pharmacy that I referenced was a local pharmacy charging $60,000. We came in and we were able to reduce that bill by 2/3 at a savings directly to the citizens of Lebanon County. So we do recognize the size of our contract in terms of the county budget. We're very cognizant of that. We also try and make sure that we provide a very good service at a reasonable price, but the reasonableness of pricing in healthcare right now may not match to other services. I believe everyone at the facility is pleased with the work we're doing, and we certainly look forward to and are hopeful that we can continue it for many, many years. This year we'll be celebrating our 38th year in existence. Our average length of contract is over 13 years, and that's with us adding 50% new contracts in the last 7 years. We still have our first contract. We have the majority of contracts in Pennsylvania. We have 84 contracts employing 1,800 people through the Northeast. So thank you for the opportunity to give a little explanation of what we do for Lebanon County. And again, as I did at the beginning, I'd entertain any questions anyone may have.
Thank you so much for this comprehensive look at what you
Yes.
and giving us a fresh look at the numbers and the facts behind what you do.
Sure. And anytime, I know we meet with the prison board, anytime you have any questions or would like a more detailed report than the ones I generally give, by all means ask. And if you have specific things you would like us to report on, we'd be more happy to do so.
Commissioners?
Go ahead.
I do have a couple of questions.
Sure.
I know, for instance, we opened a methadone clinic. Are you utilizing that or not?
We are utilizing the methadone clinic. We're worked out an MOU with them so that we could guess a dose, because typically what you'd have to do is transport someone there every day, which comes at an expense that doesn't show up in our budget, but would certainly show up in the warden's budget in terms of overtime. So we worked out a collaborative agreement with them wherein we can safely transport and then dose here. They still have to go back occasionally because the prescribing provider needs to see them at least once every 30 days to determine their compliance with the program and where they're going. We are supplying the counseling aspect of that. Anyone in an MAT under methadone must undergo a certain amount of counseling every day. If you're on buprenorphine, it's highly recommended but not required, but we are fulfilling that counseling component of it. If someone comes in and they're not already being maintained on a community provider, we would typically initiate them on a buprenorphine product because it is less expensive to the county, both in terms of the medication costs, our costs, as well as the correctional facilities costs in terms of what they have to do in manpower for managing that program.
I'm really confused because we have local mental health providers. There's one on Cumberland Street, and there's a Panessa. There's different ones. And so I'm like, are you coordinating those visits, or are you just bringing in your own people? And
We have,
I don't understand.
and that's why I was here today. We have 80 hours of professional health care psychologists and counselors in the facility that provide the care.
Okay, but are they your employees?
Yes.
Or are they our local people?
No, they're our employees. Just like our physician is our employee, our dentist who came into the facility and saw 500 people is our employee.
So are we paying for them to drive from outside of the area to come here?
You don't pay for anything other than what our monthly charge is.
Is that what we are paying for in that $3.5 million?
A component, well, we pay those individual salary. We typically don't pay them travel or an hourly rate, depending. As I said, the majority of our wages would fall under the nursing. That's the heaviest component of the staff time. You know, we're here 24 hours a day, 7 days a week. We do not pay our nurses to travel unless we encounter a shortage. We have something called our STARS programs, which are traveling nurses, because we found if you're in a shortage and in this area you can't find nurses, agency nurses don't know correctional medicine. So you can pay $80 an hour to an agency to have someone come in here and not be very useful. So we've developed our own, for lack of a better term, bullpen for individuals that will pay above what the hourly rate is in Lebanon County, for you to come into Lebanon County for a couple of weeks. We don't charge you anything different for having to rely on that service, or for the hotel that we may put that individual up for 2 weeks. That is not an additional charge that would come back to the county.
Okay. Then my next level of questioning would be Pennsylvania Counseling and Panessa and Wellspan Philhaven are local companies. So when we pay them, the money is staying here. But when we pay you, that money, you're bringing in these people from outside the area?
No, the vast majority of our workers in Lebanon County are Lebanon County residents.
That's the piece I was missing. Because I would hate to be sending $3.5 million of taxpayer money from Lebanon County out of the county.
I can understand that, perfectly logical as one of the stewards of the county to have a position to take. I doubt that you would be able to have Philhaven dedicate 80 hours of service to come into the facility and provide the services.
I am not schooled in that. I just know that we were doing it previously, and so I appreciate what you do, but I didn't know where the money was going. $3.5 million is a lot of money.
Not to interject, I am schooled in that, and I can bet you a lot of money that Philhaven could not do that.
Yeah.
Does not have the resources.
They don't have the resources.
Right now, as a matter of fact, just recently cut back on some services to local nursing home because lack of
Yeah, and
staff.
there's a backlog in the community. If they had the extra capacity, that backlog wouldn't exist. And $3.5 million is a lot of money, but 48,454 hours of service is a lot of service too.
I don't deny that, but I got more information today than I've had since, what was it, June of 2019 or whatever, and what that $3.5 million is going for.
And I'd be happy to give you even more if you.
Well, thank you. I appreciate your time.
Comments. Yeah, just as background, when I say I'm schooled, I've spent 38 years in the healthcare industry, starting out working with employers, developing an occupational health program locally here. The idea of saving money, looking at their costs and saving money, and then in the mid-90s formed a local network and did direct contracts, worked with insurance companies. Again, the idea of cutting costs, and I know healthcare is expensive, and it's in everybody's best interest. Thank you for coming today to sharing the details, because everything has a cost, but people don't always understand the value. And again, one of the questions that was raised of, geez, this cost is so high, yet our prison population is down, but I'm saying that population has no correlation to the actual cost, in that it says number of intakes, number of discharge plans, and 2 or 3 patients, and its utilization, and drug costs sometimes that can drive costs crazy. So yeah, we can argue that all day, but basically the prison population number really has no correlation to cost. It's about episodes of care and
Sure.
and
The acuity of who's coming in. And
so again, and the other thing that I can't put a price on is that I remember, I wasn't here, but I remember what the county went through 6-7 years ago with a lawsuit that appropriate care was not provided, and the settlement from that, Jamie, you recall?
$5 million.
$5 million of taxpayer dollars that was spent because we were, and I know we're getting great care, everything that I've observed in my time sitting here, so I want to say thank you. I think you're providing good value.
I appreciate that. And that's a risk that we absorb, which was not the situation back there, wherein the county actually indemnified the local doc for coming in. So that's a component of the $3.5 million. I mean, we need to be realistic of.
If I may follow up, I didn't want to go into the lawsuits, but since it's on the floor, I really have a concern about how many lawsuits for funding for others. I mean, should this be coordinated through our insurance carrier? Or I feel like we're paying insurance twice. We're paying you and we're paying our insurance company, and we're paying for the lawsuits of other counties that are being settled. We had that one, but I feel like we're paying for multitudes.
Not on behalf of PrimeCare, you're not.
No, if I may interject there, if we're named in a lawsuit which no one has any control over, we're in it, and we must provide it, we must defend ourselves. In most of the litigation that arises from inmate suits, we are defended by our insurance carrier, by Pennsylvania County Risk Pool. They provide defense to those claims, and our deductible typically is $10,000 on those.
Right.
But that doesn't have anything, if PrimeCare is named, then they provide a defense for the claims that have been made against them. So typically everyone's named. So it's not a matter
I
of
guess-
paying for it twice, or, I'm not sure what you mean by that. There are some other smaller suits that maybe they're not requesting punitive damages that we would have to defend ourselves, but if they're requesting punitive damages, we're in it, and we're being defended by P Corp.
Did you want to?
No, I would just echo what our county administrator said in regard to being named in the lawsuit. I would just echo everything that he just said.
Yeah, we can limit our liability in the contract that we have with PrimeCare, but we can't limit whether or not we're named in a suit and have to provide a defense.
And it's my recollection as well that it was as a result of that lawsuit that your carrier enlisted the services of a local attorney to conduct an audit of this area and make a determination as to whether what changes should be made in terms of the provision of medical care.
I guess, I hear what you're saying. I want to acknowledge that first of all. But I'm talking about when we pay a fee, it is because you have 84 contracts in the Northeast. And with those 84 contracts, if others are sued and have to pay larger settlements in Lebanon County, that affects our pricing?
No. All of our pricing is done on an individual county basis. Now, we have 38 years of experience. We have a rather sophisticated, what we call our what if, that we base upon, the staffing matrix drives the vast majority of your costs, as I've said. That's going to be 85–90% of the, 75 to 80% of your costs is just going to be on that staffing. Everything else is delineated down based upon the county level. So we've had losses in other suits. We have to take that internally. That doesn't come into question that we're like, okay, let's put aside $10 million this year for litigation. We're going to divide that evenly amongst the 84. There are areas of the state where we do budgeting, where it comes into consideration because of how litigious the area may be, how large the facility may be. But no, we don't risk pool, for lack of a better term.
We risk pool with our carrier,
Yeah.
but, I'm assuming
And
they
that's what I
have
thought
this-
was going on with him. And so these are pieces that I've never been privy to before, so I needed to ask.
Well, I'm shocked that this has taken 4 years to get to these questions. When you appear at our prison board meetings regularly, you're available, you're accessible, and so to
That's why I started off
suggest
apologizing
yeah.
that I must not have done a good job over the
Yeah.
last 4.5 years to let you know what we do.
Appreciate it.
For the 48,000 visits or whatever that number was, I can add a layer of confidence that they were quality visits, because that's the feedback that I get from the prison staff and so on, that it's not just the numbers, it's the quality of behind the numbers that we appreciate also.
Thank you. I appreciate the feedback. Any other questions?
No, but I want to do say thank you. I know you're an attorney and I'm just a lowly
Old attorney.
commissioner. Some people get mean when you question them, and you are always civil, so I do appreciate your tone.
Certainly hope so.
Yeah.
You have the right to ask any question.
Yeah.
I recognize it's a large number, and if you have
It
questions or
is,
concerns,
and I'm here to
I'm not to shy
represent,
away from that. So.
I'm here to represent the taxpayers, and so I do have to ask the tough questions, no matter the timing. When it's appropriate, I try and ask.
No concern. Rather
Thank you.
answer them than go on unanswered and build up some resentment or doubt or questions as to what are they trying to pull over. Rather be transparent.
Thank you.
Thank you. Okay, question.
Tom, I'm sorry. I just was waiting until the commissioners were done. Are the majority of the visits done in the prison done by nurses, nurse practitioners, or, what does that make up?
The majority are triaged by nurses. So what happens, there is an opportunity for a patient to ask for a visit on every unit. Those are picked up daily, triaged that night, they'll be seen the next day. Typically initially by a nurse. Depending if they have certain conditions, it'll all automatically be ratcheted up to either a mid-level provider or a doctor. Lebanon County has the benefit of having a physician here 3 days a week. So it goes nurses, most visits, then it is physician, and then mid-level provider. Though we are adding a full-time mid-level provider here, I think they started Monday.
And your nurses are on call, or are in the facility 24/7?
That's correct, yes. And our doctor, our dentist, our psychiatrist are on call 24/7. So if you have someone come in off the street and they identify as having psychotropic medications and we can verify those, we have a system in place. It's our goal to have a pill in that individual's mouth within 12 hours because we don't want anyone, to start to degrade because they don't have their medications available. So yeah, they're on call 24/7.
And just one final question. Am I remembering correctly from last year, and maybe Jamie, you know this, with the MAT program, wasn't there an additional allocation made so that there could be a guard when the MAT...
Don't use the word guard.
Oh, okay. When the correctional officer is there to assist with the...
The warden and I worked together to come up with what a time frame would be, or what a operational need would be, with an anticipation that would be around 25 patients a month. And then both her and I made a request to Dauphin County Drug and Alcohol for apportionment of the opioid settlement money. Lebanon County Drug and Alcohol, so that we would be able to, offset from some of this services. So yeah, a component was that, I think it was half of a CO per...
About $32,000 was allocated from the opioid settlement toward that time.
And is that recurring, annual recurring cost?
Yes.
Yep.
Okay. That's all I have. Thank you.
Okay, anything else? Tom, thank you again for being here.
My pleasure.